have to tell you a story. So I saw a patient recently, and she found me after seeing a number of different providers. But basically, she was on the younger side, had had a diagnosis of breast cancer, DCIS, and had undergone unilateral mastectomy, so mastectomy on one side with reconstruction, and subsequently was having quite significant perimenopausal symptoms. And she couldn't sleep, and she was having severe suicidal ideation to the point where she was kind of afraid for herself. And no matter all of these providers that she saw, just were not even willing to have a conversation with her about hormone therapy, which she felt that she needed. That's what she needed. And her brain was struggling. And she was just totally desperate. And so we had a conversation, and I prescribed for her. And I wanted to say, the reason I'm telling you this story is because I find it so frustrating that, number one, women are not allowed to decide for themselves. There are plenty of men with a history of prostate cancer who get prescribed testosterone therapy because, risk benefits makes them feel better. Men get a completely different approach to this than women do. For women, it's like, no, you can't have it. Suffer. It's not acceptable. But at the end of the day, she had DCIS with one-sided mastectomy. So her risk of recurrence is very low. Yes, she has risk of having another breast cancer because she had one breast cancer, so she's at risk of another breast cancer. Going on hormone therapy is not going to increase the risk of her developing another breast cancer. Her risk is her risk. So this business of withholding and, in my opinion, doing harm to this woman and to this patient because we're afraid is just not acceptable. We prescribe things for patients routinely that are much scarier and are going to cause potentially way more harm than giving this poor woman some hormone therapy.